Jessica Corbin, come on in. Hey, nice to meet you. Marty Makary. Pleasure. Have a seat. Good to meet you.
It's so wonderful to be here.
So we're talking about your company, REVITA5.
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 Like revitalization.
I have an Egyptian accent, so you got to forgive me a little bit.
You are forgiven.
So one of the cool things about this conference is we get to learn about so many cool things happening in healthcare.
Yes.
Tell us about your company and how it all got started.
Happily. So REVITA5, our big moonshot is to cure the human energy crisis and to eradicate burnout. And so this is a major issue for organizations. It's about a $300 billion issue. And organizations are trying to solve it. And they're using things like gym passes and meditation classes and surveys and consultants. But none of these options, until we came along, are tracking human capital at the physiological level. That really is tracking what teams are prime for more peak performance and then what teams are really susceptible to burnout. And so we've been working with organizations like Activision Blizzard and Autodesk and Smarty Pants Vitamins and a series of others. And we're still at the early stages. We're about 18 months in just with enterprise. But the world, and you know this because you're in medicine yourself, the World Health Organization came out and they released their first medical diagnosis for burnout, which by definition is mismanaged workplace stress.
Yeah.
So it's hit a tipping point.
Yeah.
And it's not like we can positively think our way out of this. We got to track it, we got to be smarter about it, and that's what we're solving, and that's why we're here.
So what would you say is the primary pain point that REVITA5 is addressing?
I'll address that from two different perspectives. From a corporate perspective, we're addressing the fiscal fallout associated due to burnout, which is absenteeism, high healthcare costs, and burnout-related attrition, which is very costly. But I am very human-focused. We're data-driven, but human-centered. I am very human-focused. Reducing the suffering for individuals is very important to me. And so burnout is an umbrella term for a series of symptoms, including exhaustion and fatigue.
Moral injury, loss of autonomy, sure.
I mean, and so many people are up against the ropes and they blame themselves for it. So a passion set of our organization is to educate people about their mechanism, really teach people how performance actually works, taking the stigma out of recovery. Because one of the biggest things is that people think that if I slow down, I'm weak. But truly, if you want to be great at anything, you have to time efforts to perfection, and you have to take your recovery really seriously.
Do you get sort of success stories where you get feedback on what you're doing, and what would be an example of one of those stories?
Well, just quantitatively, we can see that within 5 weeks, we have gotten organizations to increase their heart rate variability, which is the core biomarker that we track. We can get them to increase that, which is equivalent to like resilience, right? By 5% in just 5 weeks. Now, add that up over time, we're getting some serious gains. And overall health and well-being, performance, it's really inspiring what a little bit of insight and then those 1% little changes in your behavior can actually result in.
Oh wow, that's cool.
Yeah.
That's neat.
Yeah.
So what's next? Have you thought about other applications that can sort of fall under REVITA5?
Other applications.
Or other areas that you'd like to move into?
Well, I think our big focus for 2020 is really identifying all the change makers and the leaders that are willing to step into the unknown a little bit, because what we're doing is new. It is unknown, and there's a lot of resistance to the unknown. So we want to call out all the leaders, the executives that really want to move their organization from being impulsive to evolutionary, from reactive to responsive. Those are the people that we're targeting. So if you're a leader, you have an organization, we want to talk to you. If you want to be one of those evolutionary leaders, we want to be your go-to corporate health solution.
That's great, I love it. Jessica, good luck. Thanks for coming on and telling a little bit about what you're working on.
I appreciate it.